Everyone. Let me welcome all my viewers once again today on Heart Mitra. As you are aware, Heart Mitra is created for all of you so that आप सभी तक scientifically correct information is reaching you around your good heart health. And not only we post the information for you on a daily basis, but we also invite for you leading doctors from across the country who can talk to you as a friend. I'm very glad to welcome Dr. Tahir Salim Bhatt today from the city of Una in Himachal Pradesh. Sir, welcome to the program. Today, we would be using expertise of Dr. Tahir to understand something very, very important around heart failure. And you know that we have been running a series of programs around heart failure. And today, we will focus our discussion around the lifestyle modifications and how they can help manage the heart failure situation. But before I start taking your questions, let me, formally introduce Dr. Tahir to all of you. So he basically hails from Baramulla, and after doing his master's in medicine from Sher Kashmir Institute of Medical Sciences, Srinagar, he did his DM in cardiology as well as a super specialized training with a gold medal. Post that, he has been working in Una. Currently, he is interventional cardiologist at Devbhoomi Advaita Heart Institute at Una, Himachal Pradesh. He has a few papers, 4 papers published in the medical journals, and an experienced cardiologist with more than 1,000 PCIs and an experience of planting 150 pacemakers. Let me, sir, straight away get you into the conversation for your opening comments that, what is around heart failure and, can lifestyle modifications help in managing such a situation?
Thank you very much. As already you have introduced me, myself is Dr. Tahir Salim Bhatt. I am presently in Una, working in Devbhoomi Advaita Heart Institute, Una, as an interventional cardiologist. Today we will be discussing about a very important topic that is heart failure. And today the topic which we'll be touching is lifestyle modification in patients of heart failure. How we can manage patients with these lifestyle measures. And a very important topic, as all of us know, mostly people take medicines only, but the focus shifts from
Okay, it seems we have a network connection with Dr. Tahir, but by the time he comes back, we will just wait for him and we will take this conversation forward around the heart failure. Okay, so Dr. Tahir, it seems we had lost your connection
yes,
in
yes, we had a
between.
technical fault.
So,
Yes, yes, sorry. And
yeah.
as I was already discussing, we'll be touching the very important topic in this heart failure management. That is the lifestyle, this modification, which is as good as
Yeah.
taking the drugs, various pharma, various drug management. We can divide this heart failure management rightly into two. One is pharmacological, and the second is non-pharmacological. And in non-pharmacological, this lifestyle modification is very important, considering the burden and the psychological impact of this disease on the lifestyle and the quality of life in patients with heart failure.
Okay. So before we, come on and talk about the modification part of it, If you can, help us understand that what are those common lifestyle factors that can potentially contribute as well to heart failure, and if patients take cares of those risk factors or those lifestyle factors, then can they reduce the risk as well of heart failure?
Absolutely, sir. As we all know, the various risk factors which lead to heart failure, like hypertension, the diabetes, ischemic heart diseases, they are all the risk factors for this heart failure. Once we control or once we treat the risk factors like hypertension, we treat diabetes, we treat ischemic heart diseases, obesities. What we are actually doing are we are preventing the heart failure situation from arising. We are preventing this disease from affecting the individuals. So the risk factors, if we decrease the risk factors, if we treat the risk factors like hypertension, diabetes, dyslipidemias, or ischemic heart diseases, we are preventing the this heart failure from occurring in the risk group of patients. Second, some lifestyle changes like smoking, drinking, weight gain, then some behavioral these changes. We consume lot of alcohol. We consume lot of these saturated fats, red meat. We all these contributing to these ischemic heart diseases, and which in turn can lead to heart failure. If we control these risk factors, definitely we are going to have impact on this heart failure in patients who are
Okay.
getting affected by these diseases.
Yeah, no, these are, I think, very important things which you have highlighted. So for all our viewers, you should be aware that heart failure can occur because of medical reasons for sure related to your heart. And then there are, some of the other things which are under your direct control, which you mentioned, like smoking or the use of alcohol or the other fatty foods. So if you take care of these things, I think you can definitely reduce the risk of heart failure. Sir, let's move forward and let's open it up for how lifestyle modifications can be done. But even before that, if you can highlight that when we talk about the lifestyle modifications, so what all is covered under the lifestyle modifications thing? What all things are there?
See, sir, first and the foremost, what we will be discussing is we will be discussing a stepwise approach. First and the foremost, what is important in patients of heart failure, what they need to check or they need to do. The first and the foremost is the weight. They should be regularly monitoring their weight. Both the weight loss or the weight gain can be a feature of progressing heart failure. So monitoring your weight is very important, starting from the number one. Second, your just I was discussing your behavioral pattern, smoking, then drinking and eating. You should focus on your eating patterns. You should stop smoking. You should limit your rather stop or limit your intake of alcohol. You should eat, as you can see, healthy foods. It includes whole cereals, vegetables. You should take fruits. You should take poultries, fish, and you should avoid red meat. You should avoid saturated these fats. And then again, in the lifestyle, we can focus on managing your stress level. That is very important. Once you have as we know, in day-to-day life we have a lot of stress. Managing stress is very important in the part of this heart failure management. And in uh, heart failure patients usually get a lot of stress. They go into depressions because of the chronicity of the diseases. So managing your stress level is very important, and it forms a part of your lifestyle modification. And third and the fourth, what's very important is what we call as a cardiac rehabilitation program. It is as important as your this pharmacological this management. In cardiac rehabilitation program, it's very underused. It has not been used to the extent which the benefit it forms for the patients. In cardiac rehabilitation, what exactly is in post heart failure, this management program, it forms a very important aspect. In the cardiac rehabilitation program, it is basically a program driven by a physician, and it includes a nutritionist, it includes a physician, it includes a nurse, It improves psychologist. That was I was already talking to you. These patients have a lot of stress. They go into depression. Then their compliance to drugs, to diet is not as good as it should be. So the cardiac rehabilitation program is very important aspect in controlling the patients with these heart failure. So we will be discussing one by one, and the things I touched, these form the core of the heart failure management program as lifestyle modification part is concerned.
Okay, so I think here five important things Dr. Tahir has told us is in the lifestyle modifications. He has talked about the weight management. He have talked about the behavioral management on what kind of habits we have, like smoking, drinking, etc. He talked about the eating habits, then the lifestyle, and then finally the cardiac rehabilitation. We'll understand and learn from him one by one. So let's pick up the dietary management and the modifications especially related to heart failure, and I'm sure weight would also be somewhere related to that. So can you help us understand that what are the things which a heart failure patient should completely avoid while manages his diet, and are there any things which he should actively be consuming as well for good things?
As I already was talking about, this dietary component is very important. Once we are talk about heart failure, this management. First and the foremost, as all of us know, the DASH diet or the Mediterranean type of a diet, which largely is composed of these whole grains, fresh fruits, vegetables, poultry, fish, which these patients should take, which is very good for the health of the heart. And the things which should be avoided is saturated fats, red meat, as already talked about, smoking, drinking, and the other component which I will be talking is about the salt intake. The salt intake in patients with heart failure, it varies. It varies from 1.5 grams to 2 grams, depending upon the volume status of the patient, but it should not be more than 2 grams in 24 hours. Normally, what American population we have seen is they usually, in healthy adults, they have seen that salt intake is around 3.7 grams in 24 hours. So the patient of heart failure should almost be taking half what the healthy individuals usually take. This forms an important aspect as we are considering the lifestyle modification in patients of heart failure. Salt intake should be limited, and some studies or some recommendations suggest fluid should not exceed more than 1 to 1.5 liters in 24 hours. Although there are some reservations regarding this, but there is a general recommendation. We cannot say the guidelines, but there is a recommendation. The fluid intake should be around 1 to 1.5 liters in 24 hours in patients of these heart failure. And the third
And
important, which I'll be discussing, is compliance to drugs, which again forms a lifestyle modification. Despite of the fact we have medicines, despite of the fact there is a proven benefit of the drugs or the medicines in heart failure, but still patient's compliance is very important, which is again a part of his this lifestyle, this pattern governing the heart failure management.
yeah. So I think here Dr. Tahir focuses on what should be eaten and what should be avoided, and he has specifically, focused around the fluid, salt as well, and the oils as well, which one should be careful about. And if you take care of these things, I'm sure you can mitigate or reduce the risk of heart failure. So another very important aspect is the exercise schedule now and the activity schedule. Now there are dilemmas in this. People feel that if you have picked up a heart failure or a heart disease, then you are prone to breathlessness and shortness of breath, and therefore if you exert more, so you do more activity, it can worsen. So what is the right scientific advice on this? Should the activity be restricted, or should it be increased and the more stamina should be built? What's the right approach?
It's just a very important this aspect of the heart failure management program. As all of you know, the heart failure patients usually have symptoms of breathlessness, palpitations, giddiness, and they usually avoid doing some sort of activity which enhances their symptoms. But once I was talking about the cardiac rehabilitation program, in the cardiac rehabilitation program, one important aspect is exercise training. That's the very important this aspect in once we are talking about cardiac rehabilitation program. And once we are talking about this exercise tolerance, once we basically start doing the exercises, what we have seen is it has a very positive aspect considering the this cardiac remodeling. Means exercise, once we are doing as per the rehabilitation program or as per the these recommendations, it leads to your this positive remodeling of the heart. Positive remodeling means it improves your heart, this improvement in the functioning of the heart, and in turn it leads to improvement in the quality of life. It leads improvement in the well-being of the patient. Now, how to start and what to start, when to start, and how much to, these are very important questions. Once we are starting with the heart failure patients with exercise training, what usually should be done, what we call as a warm up and cool down. Warm up and cool down means once a patient of heart failure patient starts doing exercises, he has to warm up first. Means he has to start with he has to start starting from low intensity exercises, and progressively he should build up upon that. And what has been the recommendations are at least 150 minutes of aerobic exercises in a week. What now aerobic exercises are? Aerobic exercise means you can walk on a treadmill, you can do a walking, you can do jogging, you can do cycling, depending upon the status of heart failure, whether a patient is in NYHA class 1, 2, or he's in a class of 3, 4. Once he's in the class of 1, 2, he can do all these activities. And once he starts feeling palpitations, he starts feeling giddiness, or he starts feeling chest pain, then those are the times when he should start quitting or he should start reducing the intensity of the exercises. But commonly, a patient of heart failure, once he's in NHA class 1 or 2, he should do a regular exercises like walking. He can do his cycling. He can climb upstairs. He can even, some say he can do a modified form of swimming. Means in waters he can generally walk vertically. So these are the forms of exercises which lead to the positive remodeling. Then cool down. Once the patient of heart failure patient finishes his quota of exercises, then he should lie down. Lie down means he has to cool down after the exercises. And these things have shown have a positive benefit or a positive remodeling once we are considering the functioning of the heart. So definitely patient of heart failure under a cardiac rehabilitation program should do all the endurance type of exercises. And the second important aspect I would like to be touching here is some sort of endurance training. Endurance training means enhancing the muscle strength. Usually, the patient of heart failure, they have reduced muscle mass, they have reduced muscle strength, and because of the this inability to pump the blood, the muscles get reduced, the bone mass decreases, and some sort of endurance training like which enhances the bone mass or bone strength is recommended, so that the bone or the muscle mass is enhanced or increased. So aerobic exercises and some form of endurance training is recommended or is allowed in patients of heart failure.
Okay. So I think he focuses both as well as endurance as well as the aerobic exercises which patients must undertake. They are important for improving your heart health. Sir, how does a patient understand the threshold कि कितने समय तक कितने टाइम तक उसको ये एरोबिक एक्सरसाइज करनी चाहिए
This is the
या
what I was
कहाँ पर सांस फूल हो रहा है एंड वेयर टू स्टॉप.
this is what I was talking to you. It depends upon the status of the individual patients. Normally, what is recommended is you have to pace yourself. What we call as you have to pace yourself day to day. Means you have to adjust with your symptoms gradually and progressively. Once you are warming up, once you are enhancing your exercise tolerance, you may be able to do routine activities. You may be able to walk at least 30 to 45 minutes per day. But the important topic here is what I will be quoting is pace yourself day to day. Means an individual has to adjust according to his symptoms or according to his heart failure and NYHA status.
Okay, so this will be like quite individualized. So you should be knowing as an individual, as a patient, and talk to your doctor as well to know
Absolutely,
what are the
absolutely.
thresholds. But the bottom line, which Dr. Tahir suggests us that it is important and should be undertaken. You touched about, sir, the behaviors related to smoking and alcohol usage. And is there anything else which patients should be very very careful of and make those changes in their behaviors?
Regarding exercise, I would like to suggest what these individuals should avoid. They should usually avoid exercise, heavy exercise, like lifting weights, heavy weights. Like as I was already talking, swimming. Normally, what they once they swimming, they don't feel, but swimming causes all muscles to exercise. So they should usually, once I was telling you, they should prefer once they are in the swimming pool or some sort of a pool, they should try to walk in the pool rather than try to swim in the pool. So these type of exercises like heavy lifting, heavy weights, or swimming, they should usually avoid.
Hmm. Okay, all right. So very good. So this is the time we will take one question as well from the audience, although it is not related to heart failure. But we have Mr. Jarial who's asking about that his cholesterol level is high. So what should he do?
As I was already talking about, once the cholesterol, there are these components. Once we are talking about the cholesterol, the triglycerides, low density LDL, what we call as, or HDL, or VLDL, and now lipoprotein A, lipoprotein B, they all form a component of this cholesterol. Once a patient is diagnosed with this dyslipidemia, means high cholesterol, they definitely have to form their therapy again based on pharmacological and non-pharmacological. Once I was talking about the non-pharmacological, again it forms those lifestyle changes like smoking should be avoided, drinking, avoiding these saturated fats, red meat. They should prefer these aerobic exercises. And once this is part of the lifestyle medications, then this non-lifestyle means pharmacological managements. Then definitely there are a class of drugs which we have to give the patient so that their cholesterol is under control. Once the cholesterol is under control, means their risk factors are getting controlled. Means they are preventing the occurrence of heart failure in future times.
Okay, so Mr. Jarial, so right medicine compliance, right fooding habits, and some of the things which you mentioned in the lifestyle modifications, and meet your doctor. That should help you. Sir, what is your recommendation around the stress management? So it said that a lot of stress-induced, heart diseases also happen. So is there any role of stress management in reducing the heart
Absolutely,
failure?
absolutely. There is definitely a management of this stress management. As I was already, once I was talking about the cardiac rehabilitation program, I stressed on once this a team, the team formed is basically of physician, nurses, nutritionists, and very important psychologists, because these patients usually go into the depression, they go into a depressive phase. Once they go into the depressive phase, their diet, their drugs get affected. They don't take the drugs regularly. Their compliance to these diets is not what is to be this recommended. And definitely this stress management and the psychological management part forms important aspect of heart failure management. Normally the patient should avoid, means they should adjust to their stress, like they should be preferring some sort of a yoga, some meditations at home, and the sleep management. Sleep management is very important. Their quantity as well as the quality of sleep should be adequate. So this all should be formed as part of the stress management.
Yeah, all right. Sir, in your initial comments, you had mentioned about the compliance and adherence to the doctor's advice on medication. So I like you, sir, to share a little more on that. That what is the importance of that, and secondly, what is the right duration or frequency at which the follow up with the doctor or cardiologist should also be done by the patient.
So, depending upon the symptoms uh, and the classification, once we classify this heart failure, we basically classify it into reduced ejection fraction and preserved ejection fraction. The basic I will be talking here is about the reduced ejection fraction, because the drugs which have been shown to have this benefit in heart failure is vis-a-vis heart failure with reduced ejection fraction. Normally, there are the four pillars which we call as four pillars of heart failure management. Once we consider the drugs, in that includes the ACE inhibitors, ARBs, beta blockers, ARNIs, mineralocorticoid receptor antagonist, and the important is this SGL, T2 inhibitors. They form the four pillars of the pharmacological management. And once, depending upon the patient's status, whether he's an ambulatory or he's in a decompensated state, we initiate and titrate and escalate the doses of these drugs, depending upon the status of the patients, whether he's in ambulatory state, he's a decompensated state. Once patient is in ambulatory state, you can start all the drugs. Whether a patient is in decompensated state, depending upon the status of the patient, whether he's at the time of discharge or at the time of the initiation of the drugs, he's in a hypervolemic state or he's in a congested state, you can sequentially add and you can escalate the doses. And very important is once you initiate the drugs, you have to look for the side effect of the drugs also and the tolerance of the patient to these drugs. So the follow-up part is very important considering the profile of these drugs. Once we are initiating any drug, you have to see that whether the patient is tolerating, whether he is going into hypotension, whether his renal parameters are worsening or his renal parameters are remaining the same. Depending upon all these factors, you will have to call patient for on a regular follow-up, depending upon the symptoms and the individual these in the individual stats of the patients. So in brief, I would be telling, once patient of heart failure comes to you, depending upon the number of drugs he is taking, depending upon the status, he will have to definitely follow up in OPDs very closely once we are initiating his drugs. Subsequently, once he has the drugs have been initiated and he is tolerating drugs, then the follow-up period can be prolonged.
Okay. So as we are also running out of time, so we'll take just one or two last questions now. But I want to touch on that, sir. In our country, a lot of people would be there to advise you on alternative therapies. कि अच्छा अगर सांस फूल रहा है धड़कन की तकलीफ है so you do this and there are multiple so as a doctor what's your advice on are there any credible alternative therapies and even if someone has to do something and adopt any alternative therapy what should be he doing with his doctor's prescription and medicine at that
See,
time.
sir, as I was already talking, there are only the two forms of therapies. One is non-pharmacological, other is the pharmacological. In pharmacological therapies, I did not touch upon this device-related therapies. Uh, Again, a very important aspect. Some patients of heart failure who have low ejection fraction and who fulfill the criteria of in ECG, they have the criteria. Their symptoms are not they are in class 2, class 3, class 4 NYHA group, and they are in a sinus rhythm. Their ejection fraction is less than 30 to 35%. Then there is a device-related therapy which we call as a cardiac resynchronization therapy. Means these patients have been found to have a very get very benefit from this device related therapy. Means their symptomatology, their ejection fraction is, there are 70 to 80% chances the device related therapy will improve or will enhance their quality of life, will enhance their ejection fraction. In some cases, their ejection fraction becomes normal. Means the device related therapy is another aspect which has shown to have a very important important effect on the heart failure this management. But
Okay.
there is a subgroup of patients which get benefited from the device related therapy. Not all patients of heart failure will require or will benefit from the device related therapy. There is a subgroup, definitely subgroup of patients which benefit from the device related therapies.
Okay. So if you are, as a viewer looking out for the alternative therapies, then these are the three main pillars of the treatment. One is the medicines which your doctor will prescribe to you, as Dr. Tahir had earlier mentioned, 4 or 5 medicines. Then there are devices, device related. Some patients will be managed by that, and then there are lifestyle modifications, which today we are talking about. And I think if you stay within this, there are good chances that you will manage your heart failure well. So finally, before we conclude, I also want to understand this from you. You talked about cardiac rehabilitation multiple times. Is it easily available in the hospitals in our country? Who does it? Like a doctor will advise his patient on cardiac rehabilitation, or there is a separate team of people in a hospital who will do it. How do you approach this thing in your patients?
Sir, actually, I was in the beginning. I had talked about the cardiac rehabilitation program, but once I was talking, I had already stressed about it is the most underused. It is the most underused part of the heart failure this management program. What are the important components of the cardiac rehabilitation program? Definitely a physician, a nurse, a nutritionist, a psychologist. Basically, this is a team. There is nothing special about them. This is a team, a combined team, a combined effort, which is available in every hospital. But the most underutilized part of the heart failure management program. This is an integrated approach where all groups of different groups of individuals or different group of classes come together and help patient in the management program, but most underutilized. It is definitely available in every hospital. You don't need a special criteria for these. You need a simple physician, you need a nurse, you need a nutritionist, you need a psychologist who can counsel patient from time to time, and it will form a combined group effort.
Okay. Thank you so very much, Dr. Tahir, for covering all the aspects related to the heart failure and how lifestyle modifications can be helpful in this. As you mentioned about the cardiac rehabilitation, I want to tell the viewers that Heart Mitra has a cardiac rehabilitation, a dedicated cardiac rehabilitation program. And if you want to know more about that, you can talk to your cardiologist. It's a digital cardiac rehabilitation program which is absolutely free of cost for the patients related to heart failure. So, with this, I'll thank all my viewers who joined us today for this program. If you have anyone in your family or friend circle who has heart failure, or in their family they have any patient who is having heart failure, you can, or any cardiac disease, you can simply share the link of this program. And today the advice shared by Dr. Tahir can be very, very helpful for all of them. And Dr. Tahir, let me thank you here.
Thank you so much.
You took out your time. But before I, say goodbye to everyone, let me give the final words to you. If you want to, let's say, say anything important which is left out or anything in summary to your viewers.
I would just again suggest maintain your health, your diet, your good habits. All things can be managed in a combined or a integrated way. We all are here for you, but some things need to be done from your side also. Maintain your health, maintain your eating habits, and in case of any query or any queries related to your heart specialists are available to you anywhere, anytime. Thank you.
Yeah, thank you so very much, Dr. Tahir. So, if our viewers, anywhere, if you are in North India, especially in Himachal Pradesh, you want any more information or help related to cardiac health, you can always go and meet Dr. Tahir Salim. But he's a practicing cardiologist at Dev Bhumi Heart Institute at Una. However, if you are listening to us anywhere far away, then don't ignore the symptoms or the medical things which he has mentioned, and go and meet your nearest cardiologist to seek advice. Thank you so very much to all the viewers. Dr. Tahir, thank you so very much for joining in.